the largest cancer chain hospital in India.
This say one clinic Shivari, Kolkata Mapanara, three cancer, two say Pita Seoma.
So HCG family is serving for cancer since more than 30 years.
HCG Maslushi, cancer Pinashe, 30 years.
More than 30 years. So this is what is the look of our Kolkata unit.
Kolkata Mashi, HCG Hospital Kolkata, Luma, New Town.
Our hospital is just 25 minutes away from the airport. It's very near.
They say that there's a company
who has who has received the digital immediate So mostly we are tired of all the government schemes, PPAs and all the insurance companies. And we treat our patients in multidisciplinary treating approach. We use our multidisciplinary treating approach where the different specialties, doctors treat the patient as far as the cancer is concerned. So our hospital is the only hospital in the eastern zone of India which is having chemotherapy. It's a form, it's a type of radiotherapy which used to save the patient. So these are the facilities we do have at our hospital. So we have Radiax X9 radiation machine, extra electroversa LT, and we have 128 slice Siemens and 6 units of DMT, additional 4 iodine therapy, bones are level, and all these facilities we do have.
Second, you also close Masive, Kani, let it and Kani, the Sive, Tasaya, Tasaya,
This is how the radiation machine looks like.
Radiation
This is our Radiax X9 radiation machine. So, as far as surgical oncology is concerned, we are specialized for organ-specific doctors and treat them in a more specific way. So when you talk about organ specific, it is we call it is a super specialty. From toe to head, we have the different organ specific doctors available to treat the different the tumors or cancer of a particular organ. Yeah, so it includes like ortho onco, it includes like uro onco, then
cancer, cancer, assign
then GI oncosurgeon, then your breast oncosurgeon, and head and neck oncosurgeon. The concept is to give more specific and better treatment to the patient. And also, let me introduce you. We have the most advanced the robotic machine with us. So robotic surgery, performing a robotic surgery to treat any surgery to treat any tumor or any part of the body. It gives a better outcome.
ဒီစက်ရုံနဲ့ကုသမှုကဦးနောက်မှာအကျိတ်ပဲဖြစ်ဖြစ်ခန္ဓာကိုယ်မှာယောဂတစ်ခုရှိတာပဲဖြစ်ဖြစ်အဲ့ဒါကိုစက်ရုံနဲ့ကုသတဲ့အခါမှာမထိမနာပဲတင်းပြင်းများလည်းမထွက်ဘူးအထီရောက်ဆုံးလည်းကုသပေးတယ်အဲ့တော့ဆိုလို့ရှိရင်ခွဲစိတ်မှုကဒီပေါ် open surgery ကိုလုပ်တဲ့အခါကျလို့ရှိရင်ကုသလေးကသွေးထွက်တိုင်းများတယ်အချိန်ကြာကြီးပေးရတယ်ဒီဟာကအချိန်တိတ်ကြကြမပေးရဘူးအချိန်အနည်းငယ်အတွင်းမှာပဲသူကတက်တာပြောင်းပေးစေတဲ့ကုသမှုနဲ့ကုသပေးပါလို့ရှင်ဒီစက်ရုံနဲ့
So how many of you know about robotic surgery and robots? No.
စက်ရုံနဲ့ကုသမှုကြောင်းဘယ်နှယောက်လောက်သိပါလဲတဲ့
How many of you know? Just raise your hand. I just would
ဘယ်
like.
နှယောက်လက်ဆောင်ပေးပါ
So what do you think? Robot perform the surgery or it's the doctor who is doing the surgery?
စက်ရုံနဲ့ကုသကောင်းလားဒီတိုင်းခွဲစိတ်ကုသကောင်းလားဆိုတာသိချင်တယ်ဆရာ
So
စက်ရုံနဲ့ကောင်းလူကိုသိ robotic
so this is a misperception actually. Robot is not doing the surgery. It's a robotic assisted surgery. So the
ဆရာဝန်ကနေပြီးတော့ညွှန်ကြားတာပေါ့နော်စက်ရုံကိုဆရာဝန်ကဒီဘက်မှာထိုင်ပြီးသူကညွှန်ကြားတဲ့အတိုင်းစက်ရုံကသူကကုသသွားခွဲစိတ်သွားတယ်
so behind the robot there is a person,
စက်ရုံရဲ့
the
နောက်မှာ
expert
ဆရာဝန်
doctor.
ကထိုင်နေတယ်သူကဆရာဝန်ကညွှန်ကြားတဲ့အတိုင်းစက်ရုံကလုပ်သွားတာကုသသွားတာခွဲစိတ်သွားတာပေါ့နော်
So behind the robot there is an expert doctor who perform the surgery. In detail, sir will be both of the sir will be describing in detail.
တေးစိတ်ကိုဆရာဝန်ကြီးတွေကကိုယ်တိုင်ရှင်းပြပေးပါမယ်ရှင်
So as I tell you, these are the specialties like colorectal, thoracic, gastrointestinal, and gynecological, urology, and head and neck. These are the organ specific where the robotic is being performed successfully.
ဒီကုမှာပြထားတဲ့ဒီယောဂအစုံကိုဒီစက်ရုံနဲ့ကုသလို့ရတယ်ဆိုတဲ့ဟာကိုရှင်းပြပေးပါမယ်ဒီဆရာကြီး
So we have medical oncologists available at our hospital who basically give immunotherapy, chemotherapy, hormonal therapies at our center, targeted therapies at our center.
တရပီမျိုးမျိုးကိုလည်းသူတို့ကုသပေးပါတယ်ရှင်ကီမိုသီရပီတို့အားတို့ပေါ့နော်အစုံသူတို့ကုသပေးတယ်
So one more, that is a photo of the ICU. You can see the arrows are given.
အဲ့ ICU ခန်းပါရှင်ဟိုများလေးတွေပြထားတဲ့ဟာ
So these round mark are basically the cameras which are being operated, which are visualizing the patients all the time, 24/7.
အဲ့ဒီဝိုင်းထားတဲ့ဟာကတော့ကင်မရာလေးတွေပေါ့ဖက်စိတ်တဲ့အခါလူနာကလည်းကြည့်လို့ရအောင်ဆိုတော့ဒီစိတ်လုံးနဲ့ညားလေးတွေကတော့ဒါ ICU ခန်းပါ
So that's we call it EICU.
အဲ့ဒါကို EICU လို့ခေါ်ပါတယ်
So every time it is visualized 24/7, it is visualized.
သူက24နာရီသူကတိတာမြင်တာအောင်သူက on လုပ်ထားတယ်ပေါ့နော်
So we have hemato-oncology who treats all type of blood disorder at our hospital.
hospital မှာသူတို့ဒီဟီမိုနဲ့ပတ်သက်တဲ့ဟာကိုအသေးစိတ်သူတို့ကုသပေးရဆိုတဲ့အကြောင်းသူဆရာကြီးကြီးကရှင်းပြပေးပါမယ်ရှင်
So we treat bone marrow transplant, different types of bone marrow transplant, autologous bone marrow transplant, allogenic bone marrow transplant, then CAR T cell therapies, then your bone marrow transplant advanced with the Clinimax machine.
bone marrow transplant လုပ်ပေးတယ် CAR T cell နဲ့လည်းသူတို့ကဥပေးတယ်နောက်ဆုံးခေတ်ပေါ် CAR T cell နဲ့လည်းသူတို့ဥပေးတယ်ပေါ့
So we have our nuclear medicine department
သူတို့ရှိမှ nuclear medicine department လည်းရှိတယ်
with 4-bedded radioactive iodine therapy, iodine therapy rooms are there.
iodine therapy ခံလည်းရှိတယ်
So nuclear medicine department treats, suppose if the patient is having thyroid cancer, CA thyroid or CA prostate. So in such cases, this nuclear medicine therapy is being used.
thyroid cancer ရဲ့စီလန်ကြောင့် cancer တွေလည်းသူတို့ကုသပေးပါတယ်ရှင်
Therapies like radioactive iodine therapy, then PSMA, lutetium PSMA therapies are available.
သူတို့ therapy မျိုးမျိုးသူတို့အဲ့ဒီယောဂတွေနဲ့ပတ်သက်တဲ့ဟာကိုအဲ့ဒီ therapy chemotherapy တို့ ion therapy တို့အဲ့လိုလေးနဲ့သူတို့ကုသပေးပါတယ်ရှင်
So these are the other specialties which we are providing to all international patients. Basically, as we know that any patient who is coming from any part of the world, so they need a special care for their not only to the treatment but to all the other facilities also.
အဲ့ဒီမှာတခြား facility တွေရှိပါတယ်ဆေးကုသမှုတစ်ခုလည်းမဟုတ်ဘူးကိုလိုချင်တဲ့ facility မျိုးမျိုးကိုပေးပါတယ်ရှင်
So it includes like we arrange their cab facilities to pick them from the airport, arrange
လေဆိပ်ကနေထိုးတယ်ပြန်ပို့ပေးတယ်ကဲလို့လူနာတွေသွားတဲ့ခါကျလို့ရှိရင်ဆေးရုံနဲ့နီးနားဟိုတယ်တွေလည်းသူတို့ကစီစဉ်ပေးတယ်နောက်လူနာရဲ့လိုအပ်ချက်ပေါ်ဆေးလိုလို့ရှိရင်ဆေးတစ်ခုဘာမှလင်းရင်းမှုမရှိဘာသာပြန်နဲ့ထားပေးထားပါတယ်ရှင်
translator, yes, then the arranging of SIM cards, then extending their visa services. Suppose mostly we know after coming from Myanmar or any other countries, mostly if I talk about Myanmar, so patient will be getting 60 days visa, and mostly we have seen the patient needs to extend for more than 60 days.
Visa တက်တန်းနဲ့တိုးပေးတယ်အမှန်တော့လူနာစိတ်ကူးလို့ရှိရင် visa ကတော့6လတက်တန်းရှိတယ်ဒါပေမဲ့နေထိုင်ခွင့်ကရက်ပေါင်း60ပဲရှိတယ်ရက်ပေါင်း60ကျော်ကျော်နေရမယ့်လူနာမျိုးကိုလည်း visa တက်တန်းနဲ့တို့တိုးပေးပါတယ်
So in that case to extend their visa for further 2 months 3 months
နောက်ထပ်လပဲဖြစ်ဖြစ်3လပဲဖြစ်ဖြစ်ပေါ့ဆက်လိုအပ်တဲ့မျိုးဒီကုသမှုမပြီးမချင်းတို့က visa ကိုတက်တန်းကိုတိုးပေးတယ်
Yeah, we coordinate with the FRRO. So FRRO is the Foreign Regional Registration Office.
India လာဝကမှာသွားပြီးတော့သူတို့ညှိပြီးတော့ပြောပေးတယ်လူနာအခြေအနေကဆက်ပြီးတော့ကုသဖို့လိုလို့တက်တန်းတိုးပေးပါဆိုပြီးတော့လူနာဘက်ကသွားစရာမလိုဆေးရုံဘက်ကနေပြီးတော့အကုန်လုံးလုပ်ပေးပါတယ်
So this is just a moment. So I just would like to give you I'd like to play a short video of our hospital. What are the services which I have just explained. I just request you to see the video. You will get an idea of the hospital.
ဆရာဗီဒီယိုလေးနဲ့ပြမယ်သူတို့ဆေးကုသပေးရတာလေးကိုသူတို့ဆေးရုံမှာ
Welcome to the HCG Cancer Center, Kolkata's dedicated comprehensive cancer care provider. HCG Cancer Center is an NABH accredited cancer hospital that has catered to thousands of cancer patients since its inception and has helped them and their families conquer cancer. As you enter, our well laid out and ambient OPD waiting area welcomes you. All touch points at HCG Cancer Center, especially the registration and help desks, are set up in such a way that hospital formalities like registration, appointment bookings, admissions and inquiries are made as quick and seamless as possible. We have an efficient outpatient consultation department that facilitates OPD consultations for all major oncology specialties. There is one coordinator for each specialty to facilitate quicker and more seamless consultations for patients. Our goal of understanding different types of cancer before delivering the right care is empowered by our adoption of groundbreaking diagnostic technologies. HCG Cancer Center has a state-of-the-art nuclear medicine department set up to facilitate high-end diagnostic tests like PET-CT, DOTA NOC scan, PSMA, and F-DOPA. Other facilities include CT scans and an exclusive hematopathology lab. At HCG Cancer Center, our multidisciplinary care team treats and manages cancers using a multimodal approach. We have a full-fledged radiation oncology department that is run by a robust team of radiation oncologists. At HCG Cancer Center, we house the highly advanced ReadyZact X9 linear accelerator. This is a highly powerful radiation therapy platform that combines the accuracy of intensity modulated radiation therapy with precise image guidance to manage tumors effectively. We have a fully equipped medical oncology department that is capable of delivering crucial cancer care solutions, namely cancer screening, cancer diagnosis, daycare chemotherapy, targeted chemotherapy, and advanced treatment protocols like immunotherapy, targeted therapy, and hormone therapy. At HCG, we embrace precision medicine for successful cancer management. This helps us diagnose the patient's condition correctly and come up with the best treatment plan. Surgery is one of the major cancer treatment modalities. We have 2 fully equipped state-of-the-art modular operation theaters to perform surgeries for both benign and malignant medical conditions. We perform organ-specific surgeries with excellent success rates. At HCG, we lead the way in adopting cutting-edge technologies, ensuring that our patients receive the best in medical advancements. Da Vinci X robotic surgery system is the newest addition to our arsenal of cancer-fighting technologies. We are in a new era of surgical care. Here, we can prioritize patient comfort without compromising the quality of treatment. Experience the future with us, where cancer surgeries are not just advanced but value-based, ensuring a more patient-friendly journey. At HCG Cancer Center, we also have a dedicated hemato-oncology and BMT department, which is run by an experienced team of hematologists and BMT specialists who are skilled at treating different types of hematological disorders, autologous and allogenic bone marrow transplants, along with innovative treatment approaches like CAR T-cell therapy. We have 6 fully equipped BMT wards that have appropriate air filtration systems and adequate ventilation to reduce infection risks for patients and support better treatment for them. HCG goes to great lengths to deliver patients with the very best in cancer care. Today, it is one of the few centers in West Bengal to house the path-breaking Clinimax cell separation system. Clinimax plays an important role in improving the success rates of bone marrow transplants, administering successful immunotherapy in certain cancer cases, and reducing the risk of transplant rejection. HCG is also one of the few centers to have a dedicated thyroid cancer care clinic. We have 4 iodine therapy wards to support thyroid cancer management by facilitating radioactive iodine ablation therapy for several benign and malignant thyroid disorders. Our fully functional ICU has 12 beds and provides continuous monitoring and round-the-clock care for patients who are in critical condition. Our multidisciplinary rehabilitation, pain, and palliative care units support a better quality of life for patients who are recovering from their treatment. We have an in-house pharmacy that is well stocked with both onco and non-onco medicines, and we also have a cafeteria that serves fresh and nutritious food throughout the day. With a winning combination of the latest treatment technologies, modern treatment approaches, and leading-edge clinical expertise, we at HCG Cancer Center aim to help patients win over cancer the right way the first time. With over 400 oncologists and nationwide network, nobody knows cancer like we do.
So, thank you very much. Any questions? I would like to ask any questions if you have.
ဘာများမေးချင်လဲတဲ့မေးမယ်မေးဖို့လို့ရှိရင်မေးလို့ရပါတယ်သိရှိလို့ရှင်တဲ့ဟာမေးလို့ရပါတယ်
No questions? Anything you'd like to ask about the hospital or anything?
ဆေးရုံနဲ့ပတ်သက်ပြီးတော့ဘာများမေးဖို့ရှိပါလဲ
Thank you. Thank you very much.
Thank you very much, Souvik, for your nice presentation about HCG Hospital. Now I would like to call our young, handsome, robotic GI surgeon, GI oncologist, Dr. Karan Sehgal. He is going to do his presentation. So welcome, Dr. Karan Sehgal.
ဆေးရုံနဲ့ကုသမှုတော့ပြမယ်ဆရာကြီးဒေါက်တာကရင်ဆိုင်ကဖြစ်ပါတယ်
Minglava, good morning. So very happy to see everyone today, and we have been coming from quite a long time now. and we have been delivering these talks and spreading awareness, and I hope it is helpful for you people.
ဆရာရအိန္ဒိယကလကတ္တာ HCG Hospital ကလာခဲ့တာပါဒီကျန်းမာရေးနဲ့ပတ်သက်တဲ့ဟာတွေကိုအသေးစိတ်ရှင်းပြမယ်အခုလိုအားလုံးကိုတွေ့ရတယ်ဖြစ်နေဝမ်းသာကြောင်းဆရာရနှုတ်ခွန်းဆက်ထားပါတယ်
So this slide is a repetition, so I will skip them. That we are from a Healthcare Global Enterprises, so it is Healthcare Global Hospital. We have around 24 centers all over India, and all of them are state-of-art cancer-specific hospitals.
သူကဒီအိန္ဒိယမှာ24 state ရှိတယ်အဲ့ဒီ state မှာဒီဆေးရုံဖွင့်ထားပါတယ်အဲ့ဒီဆေးရုံတွေမှာဒီ HCG ဆေးရုံကအကြီးဆုံးဖြစ်ပါတယ်
So this is a map of India, and where you can see that all the centers are there all over India.
ဒါအိန္ဒိယစင်တာမှာရှိတဲ့ဆေးရုံတွေရဲ့မြေပုံလေးပေါ့နားပြထားတာဒါကတော့ HCG Hospital ပေါ့နော်
So one question, I will talk something about robotic surgery. So my colleague Shavik already asked you, do you know about robotic surgery or not? So there is one patient among us who is going to undergo robotic surgery in one and a half months of time. He is sitting with us. So he was already explained about robotic surgery and what are the risks, what are the complications, and what are the benefits. So we always try to see what are the
Dr.
benefits.
Karan, she need to translate small.
အခုကဆရာကြီးကဒီစိတ်ယုံနဲ့ကုသမှုဟာကိုရှင်းပြရမယ်အခုလောလောဆယ်ဒီမှာလေကျမတို့အခုလက်ရှိအိန္ဒိယနေပြီးတော့စိတ်ယုံနဲ့ခွဲစိတ်ကုသထားတဲ့လူနာရှိပါတယ်သူကလည်းအသေးစိတ်ကိုသူရဲ့ခွဲစိတ်ကုသခံယူနဲ့ပတ်သက်ပြီးတော့ရှင်းပြပေးပါမယ်ရှင်
So it is not the robot which is operating, it is always the surgeon who is controlling the robotic arms, and the robotic surgeon is sitting in the same room in which the patient is there.
စိတ်ယုံနဲ့ခွဲကုသမှုဆိုတာစိတ်ယုံကနေကုသတာမဟုတ်ပါဘူးသူရဲ့နောက်မှာဆရာဝန်ခွဲစိတ်ထိုးခုဆရာဝန်ကနေပြီးတော့ထိုင်ပြီးတော့မှသူရဲ့ညွှန်ကြားချက်အတိုင်းဒီစိတ်ယုံကနေလှုပ်သွားတာပါအဓိက main လှုပ်ဆောင်ချက်ကဆရာဝန်ပါပဲ
So that is why it is always called robotic assisted surgery, not robotic surgery.
အဲ့ဒါကြောင့်သူအဲ့ဒီဟာကို robotic assist surgery လို့ခေါ်ပါတယ်လို့စိတ်ယုံခွဲစိတ်မှုလို့မဟုတ်ဘူးစိတ်ယုံကို assist လုပ်နေတဲ့ခွဲစိတ်ကုသမှုကိုပြောလို့လာပါရှင်
So the surgeon is being assisted by the robot to do the surgery. So the assistant is the robot. The surgeon is the robotic surgeon, but he or she is being assisted by the robot.
ဆရာပဲဖြစ်ဖြစ်ဆရာဝန်မပဲဖြစ်ဖြစ်သူတို့ကနေပြီးညွှန်ကြားတဲ့အတိုင်းဒီစိတ်ယုံကနေပြီးတော့လှုပ်ဆောင်ပေးတာကို robotic surgeon လို့ခေါ်ပါတယ်ရှင်
So where all robotic surgery can be done? It can be done in almost all the regions of the body.
အဲ့ဒီခွဲစိတ်မှုကိုစိတ်ယုံခွဲစိတ်မှုကိုကိုယ်ခန္ဓာကိုယ်မှာရှိတဲ့အစိတ်ပိုင်းမျိုးမျိုးကိုအဲ့ဒီစိတ်ယုံနဲ့ခွဲစိတ်ကုသလို့ရပါတယ်
So it can take care of the thyroid surgery, lung surgery, esophageal surgery, stomach, liver, gallbladder, colon, rectum, small intestine, all these organs can
ခန္ဓာ
be
ကိုယ်မှာ
operated
ရှိတဲ့ organ အမျိုးမျိုးပေါ့တာရရှိတဲ့အဆုပ်ရှိတဲ့အဆိုင်ရှိတဲ့အဲ့ဒီအင်္ဂါအကုန်လုံးကိုဒီစိတ်ယုံနဲ့ဆရာဝန်ရဲ့ညွှန်ကြားချက်အတိုင်းခွဲစိတ်ကုသလို့ရပါတယ်
Gynecological surgeries and urology surgeries will talk, which Dr. Gaurav will explain you.
စီလန်းကြောင်းလည်းခွဲစိတ်ကုသလို့ရပါတယ်
Over the years, there has been an increased number of robotic procedures all over the world.
တကမ္ဘာလုံးမှာဒီစိတ်ယုံနဲ့ကုသမှုကအများကြီးဆောင်ရွက်လာတာတွေတွေ့ရှိရပါတယ်
So there was almost 2.4 million plus robotic assisted surgeries in 2024 itself.
2.4 million ကျော်ရှိပါတယ်ဒီစိတ်ယုံနဲ့ကုသမှုကများပြားလာတယ်ပေါ့အင်းကရိုးရိုးကုသတယ်အခုဒီစိတ်ယုံကုသမှုကချင်းရှာရှာကြီးဖြစ်လာပါတယ်ရှင်အောင်မြင်မှုလည်းများပါတယ်စိတ်ယုံနဲ့
So the robotic surgery is not there in this region of the world as of now, but I'm pretty sure in near future it will come here as well. But as of now, it is there in the other part of the world. That is, it has come mostly from the western part, and now almost many places in India we have adopted towards robotic systems.
ဒါကတော့အိန္ဒိယရဲ့နောက်ဖက်ပိုင်းမှာအများဆုံးတင်နေရှားကုသလို့ရတယ်စက်ရုပ်ကုသမှုဖြစ်ပါတယ်။ဖြည်းဖြည်းနဲ့တော့ကမ္ဘာတစ်ခုလုံးဒီစက်ရုပ်ကုသမှုကများပြားလာနိုင်ပါတယ်။
So like I was telling, over the years the robotic surgeries have increased drastically.
ဒီနေ့တော်များများကြာမှာဒီစက်ရုပ်နဲ့ကုသမှုကတဖြည်းဖြည်းနဲ့ပြန့်နှံ့လာမှာပါဆရာမျှော်လင့်ထားပါတယ်
So where and what is going to happen in robotic surgery? So you see that big machine of the upper left part, that is a robot.
ဘယ်ဘက်မှာရှိတဲ့ဟာကစက်ရုပ်ပါ
The lower part on the left side is a robot console on which the surgeon sits.
သူ့ရဲ့အနောက်မှာဆရာဝန်ထိုင်ပြီးဖြစ်ပါတယ်
The red arrow mark is the console where the surgeon sits.
အနီရောင်လေးကအဲ့အနီရောင်မှာတလေးပြထားတဲ့နေရာကဆရာဝန်ကြီးကအဲ့ရနေပြီးထိုင်ပြီးတော့ညွှန်ကြားပေါ့
So like I mentioned in the slide, I sit here and control all these other things.
ဆရာအဲ့ရနေထိုင်ပြီးတော့မှသူက control လုပ်ပြီးတဲ့ဒီစက်ရုပ်ကိုဘယ်ရနေဘယ်လိုလုပ်ရမလဲဘယ်လိုပိုင်ရမလဲဆိုတော့သူညွှန်ကြားတဲ့အတိုင်းဒီစက်ရုပ်ကလိုက်လုပ်ပြီးမှာပါ
Robot imitates the exact motion which I do with my wrist.
ဆရာပြောတဲ့အတိုင်းပဲဒီစက်ရုပ်ကအဲ့ဒီတိတိကျကျသူလိုက်လုပ်ပြီးပါတယ်
That is the difference it had with the laparoscopic surgery. In laparoscopic surgery, we did not have these wrist movements which are there in the robot.
ဟို laparoscopic surgery ဆိုတာsurgeon ဆိုတာကအပေါက်ဖောက်ပြီးတော့ပေါ့နော်အကြီးခွဲစိတ်မှုမျိုးနဲ့လုပ်တာနဲ့ဆိုင်ဒီစက်ရုပ်နဲ့ခွဲစိတ်ကုသမှုကပိုပြီးကြီးရောက်တယ်
So we call it 7 degrees of freedom in technical language, but for easy understanding, it is the wrist movements. The moment I do a wrist movement like this, the robot will imitate the same movement inside the patient's body.
ဒီစက်ရုပ်ကဆိုလို့ရှိရင်9 degree ပဲမှာပဲသူကကြီးရတာကုသပြီးတဲ့အချိန်နဲ့တိတ်ညာလို့အချိန်တူတူချင်းမှာပြည့်ကုသကြီးရတာကုသမှုသူလုပ်ဆောင်ပေးနိုင်ပါတယ်
So like I mentioned, this is a surgeon's console on which surgeon sits and sees and does the surgery.
အဲ့ဒီမှာဆရာကြီးထိုင်နေနေရဖြစ်ပါတယ်
This is the actual robot through which the surgery is done.
ဒါကစက်ရုပ်ကဆရာကြီးရဲ့အရှိမှရှိမှာပါ
This is a vision card, like in laparoscopic surgery. We have a stack. Same way in robotic surgery, we have this vision card. In everybody else in the operation theatre, the anesthetists, the sisters, assistants can see what is happening inside the abdomen or any other.
ကတော့အဲ့ဒီဆရာနဲ့ရှိနေမဲ့ခွဲစိတ်ခံနေရောဆရာမတွေလိုအပ်တဲ့အစစ်ဆက်တွေအကုန်လုံးကတိကျလေးလာလို့ရတယ်ဒီ vision card တွေဖြစ်ပါတယ်
So vision card is very important for everyone to see. Otherwise, only the surgeon knows what is happening inside the surgery.
ဒီ vision card ကအရင်ရေးကြည့်ပါတယ်အပြန်နေကြည့်နေတဲ့လူကဆရာကြီးပြောတဲ့အတိုင်းဒီစရုပ်ကပေချာကြည့်ရတော့ကုသလားဆိုတဲ့ဟာကိုသူ 3D လေးနဲ့ပေချာ 3D high definition vision နဲ့ပြောလုပ်ထားပါတယ်ပေချာတိရောက်မြင်လို့ရအောင်
This is a small video with which we are trying to explain what.
ဒါကဗီဒီယိုလေးပေါ့ဆရာဗန်ပြောတဲ့ဟာကိုဘယ်လိုလုပ်လဲဆိုတာကြည့်လို့ရတယ်ဗီဒီယိုလေး
Hello friends, my name is Dr. Karan Sehgal. I'm a surgical oncologist at HCG Hospital Kolkata. What is robotic surgery? What are the uses? What are the advantages? And where all robotic surgery is done? There is a common misnomer and a disbelief that robotic surgery is done by robots. Robotic surgery is done by a surgeon through robotic arms which are controlled by a surgeon. So let me tell you something about the robotic parts which will help you in better understand. This is a surgeon console on which the surgeon sits and controls the robotic arms. is a patient card on which robotic instrument.
That video is stuck, so we will skip that. Let's see if I can play it again. So anyways, this is the robot which I was telling you. It wasn't just a repetition of what we already shown in the images.
If you have the now that say show the time how you get it.
Okay. So, like I already mentioned, there are more and more number of robotic surgeries which are being performed. On your right, you can see there is this robotic cholecystectomy which is being done. So you see how this range of movements are there and how the robot is moving. So on this side you can see how the suturing is being done. So what difference between the traditional open surgery and the minimal invasive surgery? Minimal invasive surgery includes both laparoscopic and robotic surgeries. So traditional surgery, surgeon used to operate or is operating with his own hands. There is a large cut. We have to take 20-25 centimeters, sometimes 30 centimeters of incision. We have to cut the patient and go inside and then operate. So the traditional, like I mentioned, minimal invasive surgeries are the laparoscopic surgeries, which I'm sure is there in this country as well, and the robotic assisted surgery. So there are only 8 millimeters of cuts which we take to put these robotic instruments.
Robotic resolution 8 millimeter
So we sometimes make 3 or 4 holes inside the abdomen or anywhere else in the body, which are only of 8 millimeter, that is less than 1 centimeter. So like I mentioned, there is a very small scar in robotic surgery. It is a bloodless surgery, less hospital stay. There is very much less pain. The vision which we see is exactly like what is seen in an open surgery. There is a 3D vision with depth perception. When I go inside the robot, sit on the console, I can see a 3D vision, and I can actually perceive the depth as well, how much deep the organ is, and how much more I will have to send my instrument to reach that organ.
ဆရာကသူ 3D နဲ့သူကအဲ့စက်ရုပ်ခွဲတဲ့အချိန်မှာသူကလိုက်ကြည့်ရဲဘယ်လောက်ထိနဲ့ဆိုင်နေဘယ်နဲ့ဆိုင်ကြည့်ဒီစက်ရုပ်ကလိုက်လုပ်နေလဲဆိုတာကိုသူ 3D နဲ့တေချာလိုက်ကြည့်ရှုပြီးတော့ညွှန်ကြားပေးပါမယ်
The infection rate is also quite low.
ဒီယောဂပိုးဝင်ရောက်မှုကလည်းအများကြီးပါတယ်
And what do we want to do after surgery? We want to go back home, isn't it? Everybody wants to go back to their normal life, which becomes quite fast in robotic surgery.
ဒီခွဲစိတ်ကူတာမှုစက်ရုပ်ရဲ့ခွဲစိတ်ကူတာမှုဆိုရင်ဆေးရုံမှာလည်းကြမရဘူးဟိုကဘိုးဆေးရုံနဲ့ဆင်းလို့ရတယ်ရုံးသမားအလုပ်သမားတွေဆိုလို့ရှိရင်လည်းလုပ်ငန်းခွင်ကိုအများဆုံးဝင်ရောက်လို့ရတယ်
So in traditional surgeries, when there was a big incision, it used to take long time for healing.
အမှန်ရိုးရိုးခွဲစိတ်မှုဆိုလို့ရှိရင်အချိန်ကြာကြီးပေးရတယ်ဆေးရုံမှာလည်းကြာကြီးပေးရတယ်ပြီးလို့ရှိရင်ဆေးရုံဆင်းပြီးလည်းအိမ်မှာကြာကြီးနားပြီးမှဆေးရုံအယုံတို့အလုပ်တို့ပြန်ဝင်လို့ရတယ်ဆေးရုံနဲ့ကြတော့အချိန်သိမကြောက်အချိန်တိုတိုတွင်းမှာပဲဆေးရုံကဆင်းလို့ရတယ်ပြီးလုပ်ငန်းတွေလည်းပိုဆက်ပြီးတော့ဝင်ပြီးအလုပ်လုပ်လို့ရတယ်အဲ့ဒီဟာကနောက်ခုပွားထားတယ်ပေါ့ရိုးရိုးခွဲစိတ်မှုနဲ့ဒီစက်ရုပ်ခွဲစိတ်မှုက
Most of the patients after open surgeries stay in pain even years after surgery. So that is negated with the help of minimal invasive surgeries.
ရိုးရိုးခွဲစိတ်မှုကအချိန်ကြာပေးရတဲ့အတွက်ကြောင့်ရုံးသမားရုံးလုပ်ငန်းခွင်လုပ်တဲ့လူဆိုခွင့်ကြာရတယ်ဆေးရုံမှာကြာနေရတယ်ဒီစက်ရုပ်နဲ့ခွဲစိတ်မှုကကြတော့အကြာကြီးခွင့်ပြုကြမလို့ခွဲစိတ်ပြီးတာနဲ့ဆေးရုံမှာခဏပဲနေပြီးဆင်းသွားပြီးတော့ကိုယ့်ရဲ့လုပ်ငန်းကိုဆက်ပြီးတော့လုပ်ဆောင်လို့ရပါတယ်
So this is the console which I mentioned that we have 3D vision, and on your right you can see these small instruments. This is a very small instrument. This is a magnified view, but this instrument is 2 centimeters.
အသေးကျွယ်တဲ့ကရိယာလေးနဲ့သူတို့ခွဲစိတ်ကုသတာဆိုတော့ပြပါတယ်
So this is a small video again just to show how the robotic arms work and how delicately it works.
ဗီဒီယို short ဗီဒီယိုလေးပါစက်ရုပ်ကဘယ်လိုခွဲစိတ်ကုသနေလဲဆိုတာပြရတာပါ
This is how with robotic instruments we stitch, and you can see this is a plug, a very delicate tool which easily gets peeled off and easily gets pressed. So that is how the robot is suturing it.
စက်ရုပ်ကထုတ်နေတယ်ဆိုပြီးဒီနာပြန်ခွဲစိတ်ပြီးလို့ရှိရင်သူ့ရဲ့
These instruments are 20 centimeters long, around 20 centimeters long, and the tip which you see is only 2 centimeters. So that is how small these instruments are. 2 to 2.5 centimeters these tips.
ဒီနေရာလေးကသူ့ဆိုတာစင်တီမီတာပဲရှိပါတယ်အဲဒီနဲ့မဟုတ်ပါဘူး
So now see another instrument has gone inside. This is a scissors which is going to go and cut.
ဒါကတော့ကတိလေးပါကတိနဲ့သွားပြန်ချက်ပေးတာချုပ်ပေးရမှာ
Thank you. So this is a picture from our operation theatre. This is how the actual patient looks. How these I just put this picture just to show that these are the small holes which are created inside the abdomen.
ဒါကတော့ဖက်စိတ်ခံလေးပါဒီဖက်စိတ်တွေဆိုတာကတိရနေတယ်သိတယ်ဒီကဖက်စိတ်တွေဆိုတာကိုပြထားတာပါ
This is where we sit on the console,
ဘာပြန်ပြီးတော့ဒီဆက်လုပ်ထားတဲ့ဟာပါ
and this is the vision card through which everybody else in the OT can understand what is going inside.
ဒါက vision card အဲမှာဘယ်လိုဖက်စိတ်နေလဲဆိုတာကိုသူ 3D နဲ့ပြန်ကြည့်နေတဲ့ vision card ဖြစ်ပါတယ်
Okay, thank you. Again.
Thank you, Dr. Karan, for your nice presentation. Anybody have any question?
presentation, I want to ask you, what local anesthesia do you use before doing this robotic surgery?
The all are GA, general anesthesia. These cannot be done in local anesthesia.
You don't need any local rock.
So we do local rocks are just for some amount of lidocaine is given at the port site to avoid port site pain.
Yes.
But otherwise, you have to do these in general anesthesia because the patient has to be fully anesthetized. You cannot do these cases in local anesthesia.
And before doing surgery, what about any medication to reduce the pain?
So these, like I mentioned, these incisions are 8 millimeters long.
Yes.
So less than 1 centimeter. So pain anyways will be less. And sometimes at port sites we instill some lidocaine just to avoid the pain. But other than that, there is no local blocks are required. If general anesthesia is there, why would you give local blocks?
Do you use any for the electricity surgery? Do you use any diathermy,
So you saw that scissors which I was using? Scissors, it has got diathermy as well. So it is called NCS scissors. Monopolar quadric scissors.
Robotic surgery, what I do is maximally effective and minimally invasive.
Yes. So laparoscopic surgery also comes in.
The price. What about the price?
So Da Vinci.
For the open surgery, I'm doing a robotic assisted surgery. I do about 4 to 5 times the price of it.
No.
Not that.
So now
Not
the
that much.
Da Vinci was a patent system earlier.
Yes.
The system's patency has gone.
Oh,
Now everybody else in the world is making robots.
oh.
China is making, Japan is making, India has made their own robot. So that is why the cost of the robotic surgery has come down.
Oh, I see.
So now it is quite comparable to laparoscopic surgery.
So this question is like that. Suppose you are doing a breast surgery without robot, how much, and with robot, how much?
So breast surgery we are not doing with robots for now. So any, like I told you, so the difference might not be more than $7,000 or $8,000.
No, percentage by.
Percentage. So this percentage might not be more than 20%.
Only 20%, but this will reduce because the patient don't need to stay in hospital. The actual cost will be the
So
same.
if you do open surgery, patient has to stay for 15 days. Big incision. Pain will be there, painkillers will be required, antibiotics will be required more because infection is high. You will require epidural anesthesia for big incisions. Only general anesthesia will not work. In these cases, only general anesthesia is required. So in these big incisions, you need general anesthesia plus epidural anesthesia. So that cost increases. So eventually, when you start comparing that less stay is getting equivalent to the long stay in open surgery. Not equivalent, but sometimes it is, most of the time it's compensating. So let's say if a robotic surgery patient goes back home in less than 5 days, cholecystectomy patient can go next day, hysterectomy patient can go next day, colorectal surgeries can go in 7 days, less than 7 days, gastrectomy patients in 7 days. So most of these patients are getting discharged within 5 to 7 days, which in open surgeries is more than 7 to 12 days. So that I will not say exact days. That I will send you on today. It is not like that. It might vary. So it's most of the time it's 5 to 7 days, and in open surgeries it's always 7 to 12 days.
Okay.
Thank you very much.
Thank you for your question. Like I told, the cost overall will be the same because you are not going to stay in hospital more days. So overall may be same, in some cases maybe 10%, 20% more. Okay, thank you, Doctor. Now I would like to invite Dr. Gaurav Agarwal, who is the head of the Department of Robotic Uro Oncology at HCG Hospital Kolkata. So welcome, Mr. Gaurav, for your presentation.
Good morning. Minglava, everyone.
ဆရာကြီးကတော့ဖုန်းဆက်တာပါအားလုံးပဲမင်္ဂလာပါ
So, I look after the waterworks of your body, that is the urological system.
ဆရာကတော့စီလန်းကြောင့်အထူးကုဆရာကြီးဖြစ်ပါတယ်
That includes your kidneys, the main organs being the kidneys, which produce urine, the bladder, which stores urine, and the tract that eliminates urine out of your body.
ဆရာကြီးကတော့ကြောက်ကပ်ရယ်တဲချီရယ်စီလန်းကြောင့်ရယ်အဲ့ဒီဟာလေးနဲ့ပတ်သက်ပြီးတော့အထူးကုတဲ့ဆရာကြီးပါ
So, we all know 28th of April every year, World Health Day, to stay safe and stay healthy.
28 April က World ကမ္ဘာ့ကျန်းမာရေးနေ့လို့သတ်မှတ်ထားပါတယ်တဲ့အားလုံးပါနော် stay safe keep health ဆိုပြီးတော့
Health is wealth. We all agree to that.
ကျန်းမာခြင်းကချမ်းသာခြင်းနဲ့အတူတူပါပဲတဲ့
We don't need anyone, not even Mahatma Gandhi, to tell us that.
ကျ
We
န်းမာ
know
ရေးနဲ့
health is
ပတ်သက်
wealth.
တော့ဘာမှမလို့ကျန်းမာရေးကောင်းရင်အရာရာအားလုံးကပြည့်စုံပါတယ်
So, the World Health Organization, WHO, every year has a theme for that year.
ကမ္ဘာ့ကျန်းမာရေးဘွဲကနှစ်တိုင်းဆိုလို့ရှိရင်ဒီကမ္ဘာ့ကျန်းမာရေးနေ့ဆိုပြီးတော့သူကဒီ theme တစ်ခုကိုသူတို့ပြပေးထားတယ်ပေါ့နော်
For this year, the theme is on artificial intelligence, AI.
ဒီနေ့ကတော့ artificial AI ဆိုပြီးတော့ theme ကိုသူတို့ထုတ်ပေးထားပါတယ်ကမ္ဘာ့ကျန်းမာရေးက
So, when I ask you about AI, or I ask anyone, the first thing that comes to mind is ChatGPT.
AI နဲ့ပတ်သက်တဲ့ဟာတွေကိုဆရာပြောပါတယ် ChatGPT
Am I right? Do we all know about ChatGPT? Have we heard about it?
အားလုံးသိကြလားတဲ့ ChatGPT တောင်း
Yes, I can see some head nodding, yes. See this. A lady has said that ChatGPT saved my life, picked up cancer before the doctors.
ဒီလိုမျိုးက ChatGPT ကိုသူကလေ့လာပါတယ်ဒီစေရုံတက်ခဲ့ပေါ့
This was a 40-year-old lady in the States who said that ChatGPT helped pick up her cancer even before the doctors.
သူကဒီနဲ့40ရဲ့မျိုးသမီးကဒီ ChatGPT မှာသူကြည့်လိုက်တဲ့အချိန်မှာသူကဒီ cancer ဖြစ်တယ်ဆိုတဲ့အကြောင်းဆရာဝန်နဲ့မပြနိုင်နေရသူသိထားပါတယ်
So it's so easy. I just type my symptoms and ChatGPT will give me a diagnosis.
အခုဆိုလို့ရှိရင်လွယ်သွားတယ် ChatGPT နဲ့ကြည့်လိုက်လို့ရှိရင်ဒီပေါ့နော်ဒီစစ်ဆေးမှုလုပ်လို့ရှိရင်လွယ်ကူကူသိနိုင်တယ်
But there's always the other side of the coin.
ဒါက
There is always another side.
ဒါကအမြဲတမ်းတခြားတစ်ဖက်နဲ့ညီမျှတယ်ပေါ့
Any inaccurate diagnosis can cause you more harm than benefit.
ဒါကတော့ diagnosis လုပ်တဲ့အချိန်မှာတိကျတဲ့အဖြေကိုရရှိရပေါ့ဒီ ChatGPT နဲ့ကြည့်လိုက်တဲ့အချိန်မှာ
Please type in ChatGPT headache and see what it gives you. I'm sure you'll get scared.
ခေါင်းတိုင်းနေရဆိုတော့ရိုက်လိုက်လို့ရှိရင်သူကတိကျတဲ့အဖြေကိုထုတ်ပေးရပေါ့ ChatGPT မှာ
So where does this AI come in surgery or in surgical practice?
AI ကဘယ်ကနေလာလဲဆိုတဲ့ဟာကိုဆရာရှင်းပြပါမယ်
It's artificial, so it's taking some time. I think it's really simple. So the artificial thing took its own time, and in surgery, AI is the robot, the robotic system.
AI ဆိုတဲ့ဟာက robotic system ကိုဆိုတာ
So this term robot actually is a very old Czech word, was used in a play to say that robots are actually your slaves, they're not your masters. So this term goes way back to 1920.
ဒီဟာက1920တုန်းကပေါ့နော်
And robots have evolved over time. From 1999 to date, the robots have become smaller, thinner, to give you small cuts on your body and better precision.
1999ခုနှစ်ကစက်ရုပ်ကသေးတယ်2006မှာသေးတယ်တဖြည်းဖြည်းနဲ့သူကစက်ရုပ်ကြီးတွေနဲ့သူကကုသမှုကိုစတင်လုပ်နိုင်ခဲ့တယ်
Like I said, I look after your waterworks. So this is what comes in. The main organs which can be done by a robot are the prostate, the kidneys, and the bladder.
ဒီစက်ရုပ်နဲ့သူကစီးစိတ်ရဲ့ဒီသဲချင်ရဲ့ကြောက်ကတ်ရဲ့အဲ့ဒီဟာကိုဖိစိတ်ကုသပေးရပါတယ်
And these numbers, since a robot has come in, have increased tremendously.
ဒီဥပြထားတဲ့2003လောက်နေတာဒါဒီစက်ရုပ်နဲ့ကုသထားတဲ့ဟာတစ်ဖြည်းဖြည်းနဲ့သူကဒီမြင့်တက်လာတာပေါ့နော်
Have a look at the graph. The robotic numbers in blue are way above the laparoscopic and open numbers for a prostate.
အပြန်အောင်လေးကတော့စက်ရုပ်နဲ့ကုသထားတဲ့နံပါတ်ပေါ့နော်မြင့်တက်လာတဲ့ဟာကိုပြပေးတာပါ
Similarly, for a kidney, the numbers have gone up.
ကြောက်ကတ်လည်းကိုကြီး၎င်းပဲကြောက်ကတ်ကိုလည်းစက်ရုပ်နဲ့ကုသတဲ့ဟာအပြန်အောင်လေးနဲ့ပြထားတဲ့ဟာကနံပါတ်မြင့်တက်လာတာဒီစက်ရုပ်နဲ့ကုသမှု
And for a bladder, the numbers are coming up. So the robotic numbers are going up for all the advantages that have been told to you by my colleagues till now.
တဲဒီအပူလေဒီ robotic နဲ့ခွဲထားတာကအပြန်အောင်နဲ့ပြထားတဲ့ခွဲပြီးတာဒီ robotic နဲ့ခွဲထားတဲ့ဟာနော်
So it's now an accepted standard of care in surgery and in particular for cancer surgery.
ဒါကတော့အဓိက cancer နဲ့ပတ်သက်တဲ့ဖွဲ့စည်းမှုကိုဒီစက်ရုံနဲ့အဓိကလုပ်ပြီးပါတယ်
So the advantages we all know, we've been told smaller cuts, 8 millimeter cuts.
ဒါကတော့ခုနပြောထားတဲ့ CI နဲ့အတူ